Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, Dr. Mencia. It's awfully wonderful to talk to you this morning. Of course, we just had a very nice interview with an author, and we never talk about your book. I think it might be a very good subject this morning. Yeah. We ought to be selling your book. We ought to really be promoting it again. Maybe it's time that I do that again with you. Why don't you talk to people about your book and what made you write it?
The book. Well, first of all, because people sometimes they just put on the headphone to listen to us and go for a walk. It's extremely foggy outside. I never seen it this foggy in Florida. Extremely foggy. So please, even if you go for a walk, cautious first. Make sure you have something that light up. And if you're walking in a place that there is no sidewalk, be careful because it's going to be really hard for car to see you. I was using the high beam to make sure, that whenever there was no car coming the other direction, I would use the high beam so I can look in front of me. And it's interesting to see people, walking in a day like today. This is crazy. I mean, people need to be more cautious. Both the driver and the pedestrian. We need to both sides to prevent accidents and deaths. So, having said that.
Yeah, well, thank you. No, it's a good point to make people know that. Because once they fall, that's it.
And that's over with the news and the weather. It's going to be sunny today, 82. No. The book.
It's I'm
going to work for one of those channel news or something.
Oh, yeah.
Yeah. I was invited to the, Pennsylvania Nursing Association, the national meeting. I was the keynote speaker some years back. And they asked me to talk about the relationship between anemia and the kidneys, because little is known and people usually don't make the connection between a person becoming anemic and having poor kidney function. So, at that point, I was a national speaker for a pharmaceutical company, and I would lecture all over the country on anemia and kidney disease. And that's why I guess they chose me to be the keynote speaker. And as I look at all the material that I had, and I say, wow, I have so much material, and it's so little known about the kidneys. We talk about the heart and how important to prevent a heart attack. And we talk a lot about the brains, a lot of interest in the brain. But until we hear of celebrity basically losing their kidney and going into dialysis, we don't think too much of the kidneys. And I say, I think a book will bring a lot of awareness because the nurses pick a beautiful topic. And these are nurses. These are people that know about health. So imagine the lay person out there. So I said, let me put this material together. Then I went back the way I like to do things. If I'm going to write a book, let's write it so that the reader can use it for prevention. Not only for treatment, but how do I prevent from having kidney damage? And the other point that motivated me, ladies, Anita, Anita.
Yes, we're listening. We're listening. Yeah. We're holding on to everything you say.
The other thing that motivated me was the fact that as I go through the stages of kidney disease, you have like over 500,000 people on stage 1, which is the very early stage, another 500,000 on stage 2, and then like 200,000 on stage 3. And then 150,000 on stage 4, which is just dialysis stage and so on. And I say, why the drop? Why so many on stage 1 and 2? There's a sudden drop on stage pre-dialysis. And I did my research, and what happened is that most patients with kidney disease are dying even before they reach dialysis. So we look at dialysis like a curse. We have to go and get dialyzed, get the blood cleaned 2 or 3 times a week. But in reality, those are the survivors. Those are the lucky ones. The curse are those that die earlier. And that was a big motivation. I said, oh my God, I didn't even know this, that so many people were dying even before they reached dialysis. So I got really motivated when I saw that. I said, we have to bring awareness. People don't even know this. And I wrote the book, and then now it had become, and I don't think my book had anything to do with it. It was one of the first books that came out, for the layperson on kidney disease. And still there are not many people that have followed through on what I have done. And now it has become national standard to put in the lab. Before I wrote the book, the glomerular filtration rate that tell us, and it's a calculation that we have to do, it tells us what is the level of damage on the kidney. Is the kidney completely normal, or is it stage 1, stage 2, stage 3, 4, or 5? And now it's national standard. All national laboratory, when they give you the blood result, they're going to give you the sodium. If people that are at home and you have blood result, from the top, you're going to look at in the chemistry side, okay? You're going to see the sodium, the chloride, the sugar, the BUN, the BUN, the creatinine, and then you're going to see GFR. And it says GFR, non-African American, and GFR, African American. And it's going to be 2 different numbers. And then if you are African American, you look at the one that is pertinent to you. If you are non-African American, you look at the one that is pertinent to you. And the GFR gives you an idea of what stage you are in. And once you have nailed that, and you have that stage, then you are obliged every 3 to 6 months to get your kidney checked again. So you see if you are getting worse, are you getting better, or are you stable at that stage? Now, how do we prevent damaging our kidneys? By not being so passive when you go to your doctor. So you go to your doctor and you have a little viral infection, and the doctor say, okay, I have to give you something, so I'm going to give you some antibiotic. And you might say, well, I don't want to take antibiotic. And the doctor can get mad at you. I mean, I don't get mad at my patient. I work with my patient. And if I think that you really have to take antibiotic, that this is something, then I will try to convince you, or I will work with you. But if I think that your choice is not really such a bad decision, then I work with you and I keep that open door. If you see that you are getting worse and you need me, come right in or call me so we can continue the process. Because a lot of times when it comes to prevention of kidney disease, it is induced by taking too strong of antibiotic and certain medication that tend to damage the kidney. I had a patient that came to see me, was taking 2 water pills and has stage 2 kidney damage. And I asked her, why are you taking 2 water pills? She said, well, I went to the doctor some 8, 9 years ago, and I had my ankle was swollen. So he gave me 1 water pill. Then I called the doctor and I said, my ankle swelling is not going down. So he gave me a 2nd water pill and it went down. And I said, of course, because
9 years, and she kept doing.
She kept taking it like nothing. The doctor kept rewriting the water pills. And I said, well, do you have lab from 9 years back? She said, no, not really. I said, well, probably 9 years ago your kidney function were completely normal, but now you are really damaging your kidney. So why don't we do a trial and try to slowly get you off from those water pills? Avoid salt, elevate your feet 2 hours every afternoon, and let's see what happens. She went from stage 2 to normal kidney function.
Okay. Well,
so, there are many things people can do that, some people, they just like one prescription. Give me something. Doctor, just give me something. And a lot of time, just talk to your doctor. And as long as your doctor is available, they are not going out of town forever, and they're not getting ready to die and leave you alone, Work with your doctor, don't rush into taking more and more and more pills.
I have a lot of questions. I've let you keep talking, but I have a lot of questions on
you
kidney.
Open a subject here.
I know that.
Mamma mia.
Mamma mia. First, let me tell everybody, you're listening to Dr. Andy Mencia. He is the founder of AGI Medical and Dental Centers. There's the main one is in Fort Lauderdale, and then they have another one they've opened. It's in Boynton Beach, and the phone number in Fort Lauderdale is 954-489-1345. And in Boynton Beach, it's 561-270-6494. And I will add that home visit services are available for homebound patients. I want to get back to the kidney. How does someone know that they even have a problem with their kidney? Let's just start
That's a great question.
The beginning.
Beautiful question. The only time you're going to know if you have severe kidney damage, that you are at the level, you are one of those lucky ones that didn't die at a pre-dialysis stage, and then suddenly you start not peeing, and you're drinking fluid, and you say, why am I not peeing? I'm drinking enough fluid, why the urine is not coming out? And the kidneys, if we think about it, and in my book I give you from the genesis, from the way the kidneys are formed when the sperm and the ovum come together and the baby start being formed, from the fetus formation to the embryo forming the kidneys, all the way to how does it work, the physiology of the kidney. And I tell you about the anatomy, where the kidneys are located in your body, so you get an idea. And then I'll take you through all the different diseases and so on. So the kidney function, when you look at the physiology, they are filtered. They're supposed to take the blood that circulate through your body, and they go through the kidney to get all the junk that the blood have picked up as it's circulating, and get rid of it. When the blood go through the lungs, they go there to pick up nutrients like oxygen and get rid of carbon dioxide, go through the lung. So the lungs also serve as a filter, but just for gas. The kidney for all of those chemicals. So if they shut down, of course you cannot pee, because pee are produced as a byproduct of the kidney function. So people cannot pee, and they go to the hospital and they put a catheter and nothing is coming out, and they do a blood test and say, oops, we have to put you through dialysis now because your kidney has shut down.
Wait, excuse me. I mean, from peeing
completely
and then all
normal,
of a sudden to not peeing?
It's not sudden. The problem is that when it comes to prevention, people tend to not go to the doctor and get blood tests. They just want to bury their head in the sand, and they don't want to see what's going on. If I don't see what's going on, then why should I worry? If I don't know something is wrong, then I don't have to worry. So it's a mechanism, stupid mechanism that we use. It's playing, I'm sorry, talking about your country now, Russian roulette.
Russian roulette,
It's
right.
playing Russian roulette because, you go to the doctor in a year. I get patients, they come once a year, and it's their choice. They listen to us in the radio, and they know what they're doing. They understand the consequences of what they're doing. But they come once a year and say, how am I doing? So I look at the lab from a year ago, and I look at the present lab, and I tell them, what had declined, what they can think. And they won't come back until another year, until one day they listen and say, you know what, he's right, let me go ahead and come a little bit more often. But why wait a whole 12 months? Your insurance company will pay not only every 3 months, but if the doctor so see need, and he want to recheck your blood test in a week, certain portion, not the whole thing, certain portion of the blood test in a week, you can have your blood test recheck in 1 week. So, I
want to talk about the name of your book. It's really important. Take care of your kidneys, and they'll take care of you. Right? Is that the exact
absolutely,
name?
Absolutely.
I have that ingrained in my brain.
Yeah.
And we really should be buying that book because Dr. Mencia doesn't like to really brag the way authors brag about their books, but I'm going to brag for him. It is one of the most comprehensive books I have ever read. I didn't know very much about the kidneys, but I do remember it, and I need to get it back again and review it because it's an excellent book. And I just was going to ask you a question. Why do the elder population, why do they have to urinate a lot more?
Oh, well, several things. Number one, as we age and we don't take care of our body, there's two types of aging. You have people that age passively, and there are people that age actively. And you and I, since we met, we've been talking about writing a book on living over 100. And we have not done that. We have not sat down to get together to do it. And we should do it. I know, yeah. Yes.
We will.
We will.
Invite me over.
So as we age, people age either passively or actively. People that age passively, they tend to lose muscle mass. It's a given. It's written in the good book. I'm just kidding.
Your book.
In my book. It is written that if you age passively, you're going to lose muscle mass. And how can we prove that? Well, look at your body. If you have ever had a cast put in your extremity for whatever reason, if you have a cast put in for a few weeks and you go with the centimeter and measure the circumference around the limb that the cast was on and compared to the other limb, you're going to see it's going to be thinner because you lost muscle mass. So the lack of activity will, by law, make the muscle more atrophic, smaller and weaker. So losing muscle mass put a strain on the kidney. The person that is active tend to retain or maintain their muscle mass. They don't lose muscle mass. So they maintain good weight, and they maintain, there is no, those proteins that get degraded, they are not going to the kidney to be processed and thrown into the urine. So that's a good thing you are doing for your kidney. By protecting your muscle, you are protecting your kidneys. The kidneys is like a pump that works for your irrigation system. If you shut down the water, but then on the electrical component of the pump, you can blow up your pump because it's working without water. So when you dehydrate yourself, Ina started drinking water right away.
You're right.
When you hydrate yourself, when you drink enough fluid, you drink enough water, then you are giving the kidney what it needs to flush all the waste material. Otherwise, what's going to happen is that, well, let's say we're dealing with sugar or salt at home. You take, let me see so we don't waste too much sugar. 3 cups of sugar. Take 3 cups of sugar and put it in a jar. Then take 3 cups of sugar, put it in a different jar. In one jar, fill it up with water, and the other jar, just put like 1/10 of the water. And then you stir that really nicely, and then you see which one is going to be denser. And you don't have to do the experiment. You know the answer. Of course, the one with less water is more dense, more concentrated than the jar that you fill up with water. It's more diluted. The one that is more diluted when it goes through the kidney is a piece of cake with frosting, the way I like it. Yoo-hoo! And a cherry on top. So it's going to go through the kidney and it's going to be processed beautifully, and the kidney is so happy go lightly. Ooh, I'm going to make so much urine. The other one is too concentrated.
This is really interesting the way you're sharing
too
that.
Concentrated. And so then there you go, drink your water.
Drinking my water now too.
That's, water is such a, people, we sell product, we sell, supplements and stuff like that, I never
buy them.
Yeah, I know. And I use them too. And I never come to the radio like to promote supplement. Oh, come on, buy this. It's,
Right.
It's not the type of show you and I have
No.
put together. But, we sell supplement. But I tell my patient, you can go and buy the supplement. You're not going to make me rich or nothing like that. We're not selling those high volumes. You can buy the supplement and there's a profit for the staff, a bonus and what have you. Everybody benefit when you buy in my office.
Yeah, but you buy, but it's because you have high quality
Quality
supplements.
stuff.
That's why
Absolutely.
I buy them there.
Absolutely. High quality product. Because I say if I'm going to do it, I'm going to do the best, not the cheapest to make them, who's going to give me the biggest margin of profit. No, we're going to sell it. Let's sell the best. And as long as we are not here losing money, then we're going to be okay. And there's still a profit for the staff. So I'm happy. Everybody's happy. My patients are happy. So we sell products. I say, you don't have to buy my product if you drink a lot of fluid. Just drink water, for God's sake. Drink a lot of water. Water is the key to the universe. With your whole body need water. You need water to maintain your skin healthy. So we need to drink water. I drink water even at night when I go to sleep. I put a bottle of water at the bedside. And if I wake up for whatever reason, look at the time, take a sip of water, take a little bit of water. No, a sip. I drink some water and then go back and lay down and go to sleep. If I have to get up and urinate, then I get up. If I don't feel, just drink some water and go to sleep. But if I sleep the night through, when I sit up in the morning, the first thing I do is drink the whole bottle of water.
Well, I think this is really important because I'm going to do that. I'm glad that you've done this. I should do this when I first get up, go to the bathroom, and then drink a glass of water.
Absolutely.
I never think about that. And I'm sure everyone listening, they don't do that. They get their coffee. And they, start
and you ask
things.
patients, why you're not drinking? Oh, every time I drink, doctor, it make me pee.
That's
Good,
right.
the kidneys are working.
Okay, but a lot of older people.
But that's a myth. That's a myth. The myth is, the misconception, which you say, is that if I don't drink, then I don't pee. But the kidney have to process the blood that is circulating. So whether you drink or not, you're going to produce urine. So why not drink? So at least, in the process, because you could have a problem with the bladder. It have nothing to do with your kidney. So when a person say, the moment I drink 2 sips of water, I have to go and pee. I say, okay, let's do an experiment. When you go home, because I don't have time in my office to do the whole thing with you. When you go home, the first thing I want you to do, go and pee. Then I want you to take not 1 glass, 3 glasses of water and drink it. And then time yourself to see if it is true what you think, that the moment you take a sip, you're going to pee. And they go and they say, you're right.
It's not true.
No, right. Of course. Everything needs to be processed. It's not magic. You put water in your mouth without swallowing and automatically you have to pee it. No, it have to be processed. You have to swallow the water. It have to be absorbed by the gut. It have to go into the system. It go through the kidney. Then the heart will take that water that you have absorbed and process the heart. The heart will pump it throughout the different organs. And then it will go and be part of the blood system that you have presently. That takes time.
Dr. Mencia, this is a fabulous subject because I think everyone who's listened, if nothing else, you're going to definitely wake up and have a glass of water in the morning. You actually should buy the book, Take Care of Your Kidneys, and they'll take care of you. You can buy that at Dr. Mencia's office.
You can even get it at Amazon if you have problem coming to the office.
Amazon.
We have people that listen to us from Europe, so you can even pick it up in Amazon, Amazon.com.
And then when you see Dr. Mencia, he'll sign it for you.
Yes.
And then the other thing that I think was really important, let's not get to level 4.
Absolutely.
We don't want to do it. I mean, even though you're going to live with dialysis, it's better to go get checkups with Dr. Mencia, more maybe even every 3 months and make sure everything is working properly. So let me give your phone number out again, 954-489-1345 or 561-270-6494, AGI Medical and Dental Centers. Be sure to read the article in Boomer Times, which is Help is Available for Anxiety, Sadness, and Depression. It's on page 4 in the January issue. And Dr. Mencia, we did it again. Thank you very much.
We did it again. And remember that, when you go and get your driver license, you can become an organ donor. So there are many people that, because dialysis, Richard, we're going to take one more second. Dialysis is only a buying time before you get kidney transplant. So a lot of people that die, I'm an organ donor. A lot of people that die, they are waiting just for kidney transplant, for a donor to give their kidneys away.
True.
So
Kidney
please, when you go for your driver license, become an organ donor.
Good.
Thank you.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.